Hello, my name is Christensen-Levy, and today I will be showing you how to perform the hip Scour or Quadrant test. The pathology of the hip Scour Quadrant test is to test either a labral tear or femoral acetabular impingement. And the term Scour actually means rubbing hard against, and that's what's going to happen when we move the femoral head in the acetabulum. The sensitivity of this test ranges from 0.62 to 0.91, while the specificity ranges from 0.43 to 0.75. To perform this test, have the patient lie supine, and as the examiner, I will stand on the lateral side of the hip that we will be testing. In this test, the patient does nothing as this is a passive test, so I will be performing all the actions. To perform this test, you're going to put the hip into 70 degrees of hip flexion, and then my hand placement is going to be interlocked fingers over the knee, and I'm going to push down and provide a longitudinal compression force down the femur. Next, I'm going to take the hip into 120 and 130 degrees of flexion while adducted. And I'm going to repeat this 2 or 3 times. Then, when I get back to the original 70 degrees of hip flexion, I'm going to abduct the hip and repeat. A positive result for this test would be the patient experiencing pain or I hear a click. Now, the hip Scour is actually a modification of the FAIR test, and the FAIR test stands for femoral acetabular impingement. To perform that test, the patient lies on their side with their affected hip up, and the examiner stands on the lateral side of the hip that they will be testing. The top hand will be placed on the hip, while the bottom hand will be placed on the knee, but a modification could be that if the hip is stable enough, perhaps with a pillow behind it, that you could put both hands on the knee to carry out the actions. And this test is passive as well. So to perform this test, you're going to put the hip into 90 degrees of flexion as well as flex the knee 90 degrees, then fully adduct the hip, and then internally rotate. A positive test would be pain in the hip or a lack of end feel, as this one does test for impingement. Thank you.